thrilled to be joined by Donald Jones, who is a globally recognized leader in digital medicine, technology, in the health services space, with a really amazing breadth, depth, and many years really driving transformation in healthcare. But I don't want to speak for him. He can speak about his background better than I can. So, Don, thank you for joining. You want to share a little background and bio on yourself before we jump into some of the questions?
Sure, Amy. Thank you. And thanks for the Columbia University HITLAB participation. Appreciate that. I'm just going to summarize the headlines. 25 years in emergency medical services, running the largest company in the world, building and managing medical practices, totaling over 40,000 doctors, working with many companies through 11 and a half years at Qualcomm, over 2,000. And then the last 5 years, having started a venture capital firm with Takeda called TDV, and working on the boards and advisory to many companies, as well as Fortune 500 companies as well. So lots of different diversity in my background. I'm a bioengineer, lawyer, and business school graduate by background. I try not to get involved in the clinical side too much. I try and stay on how do we improve the consumer or patient experience in my work.
Well, that's amazing. We're very fortunate to have you here with us today. And you clearly are an expert in this space and have probably seen many different trends come and go over the years. And we want to talk a little bit during this session about digital wireless technologies and how it's revolutionizing healthcare delivery and patient care. And as a follow-up to the prior conversation and some of the polling that went on, there's all the talk about AI, whether it's in healthcare or really any other industry. And from your perspective, we're hearing a lot about ambient AI in the exam room clinic setting, which is great, I think, when it comes to capturing the patient information for the chart in a very ambient way and help facilitate and create efficiencies with the documentation process that are part of the workflow. But from your perspective, what other opportunities are you seeing for things like ambient AI in the clinic setting or in the exam room?
So right now I'm tracking in excess of 50 companies offering ambient AI. So it's kind of a hot space, attracted a lot of money, and frankly, I don't predict a great result for the core business model, which is charge per doctor for basic SOAP note preparation and EHR integration. I actually predict that value proposition is going to zero, meaning it's going to be given away. And the reason is there's a lot of other value propositions that actually have a lot more value to them. And I'd like to think of them as where are the near-term ROIs versus the long-term ROIs. So there are a number of folks actually talking about how we can improve the quality of the medicine, clinical decision-making, et cetera. I put those in the long-term ROI equations, partly because they're harder to measure the impact, and the financial impacts are distributed among all the players, the payers, the healthcare systems, and the providers. The things I'm more interested in right now, at least over the next 3 or 4 years, are the things that have immediate ROI. And this is where I see the change. So things like prior authorization, automating that process of prior authorization, just something as simple as completing the RXs. If the conversation includes the physician saying, I'm going to give you a prescription for ampicillin, well, the prescription can actually be completed and ready to go for one click of the button, rather than taking additional time. The real opportunity, and if you look at the Kaiser study that came out not too long ago, showed an hour and 15 minutes of savings per doctor per day. And then on top of that, you saw a class come out and say that the health systems expect to deploy ambient AI in the exam rooms in 58% of the systems in America this year. So this is the fastest adoption of technology in healthcare that we've probably ever seen. But as we move down the list, I see super bill preparation, automatic coding, quality assurance, preventative care recommendations, protocol adherence analysis, medication recommendations per appropriateness, per personalization, and by formulary, insights into potential selections of medical devices and pharmaceuticals, customer satisfaction, physician reviews. How is the physician actually conducting themselves? Has this physician got good bedside manner? These are kinds of things that health systems are going to be able to do with the AI. These are all the things that we're going to squeeze the economics out in the next few years. The economics of are we going to make a big difference in healthcare costs long term are going to take a much longer to measure. And as a result, that's not where I'm focusing my time or effort right now, because there's immediate ROIs to obtain that can be squeezed out in the year you deploy.
And from your perspective, when we're talking about how AI is being used to support a lot of efficiencies, when we think about time savings for the clinician and things like that, do you have any perspective or insight on how the actual clinicians are feeling about the efficiency involved? So yeah, now they have more time back, but is that time now being spent seeing more patients and being sort of pressed with doing more now that, or doing other things that they didn't have the time to do before, and it's actually creating more pressure for them? Or is it sort of giving them a little relief from their workload? I'm just curious if you've heard any feedback on that based on
I have. Yeah, no, that's a great question. I have. And I think if you want to look at the most significant divider in the marketplace, it's look at who your employer is. If I get an hour and a half or so, plus or minus, of new free time, and my employer pays me on a salary, chances are I'm going to be asked to become more productive. If I'm in private practice, I can choose what to do with my free time. And if I want to make more money, I'll see more patients. If I want to spend more time with the family, that's what I'll do. And so I think the big driver and the thing you would look at, Amy, is who am I employed by? And if I'm self-employed, I've got a lot more freedom in the answer to that question. And if I'm employed by a system, I can probably bet with a fair high degree of certainty that those savings are going to be turned into productivity, which I think on one hand, the doctors are reporting back they're quite happy with the system taking them away from the computer screen and allowing them to interact more closely with the patient. On the other hand, when they're asked to go from 22 patients a day to 28 patients a day, I'm not sure they're going to be quite as happy about that. But I think that's the reality.
Yeah, that can be very stressful. And again, I think it's important, like we think about all this amazing technology that can really support improved efficiencies, outcomes, things like that. We always have to remember that there are usually human beings at the end of the end user of all of these things. So it's really important that as we're bringing these things to market and using them, that we don't forget the human aspect of it and the opportunities that we have to improve the overall experience, whether it's for the patient or the provider. But really interesting stuff that's going on. And I think it's almost like with AI, it's like, how can we almost can't even think of all the opportunities that we have. But as we start in one area, more things will continue to grow. So super exciting. So switching gears a little bit into kind of the general landscape when we think about the development of apps and care monitoring technologies that we're seeing come into market, whether it's for diabetes management or obesity management or cardiovascular disease, things like that. Where are you seeing opportunities for these types of monitoring and app technologies to sort of expand or lock in different customer bases?
Yeah, I think one of the most exciting areas in the wearable space is essentially wearable continuous laboratory results. And we've had it now for quite some time in the form of continuous glucose monitoring. But this year, going into 2025, we're likely to start seeing lactate and cortisol being measured and available. And then we're likely to see other enzymes come available, and again, in very small, wearable, disposable patch technologies that continuously, meaning perhaps every 3 minutes, every 5 minutes, of differences between the manufacturing approaches, will sample different enzymes. And I think we're going to see things in the liver space, in the kidney space, potassium, for example, troponin for cardiac. You can imagine, for example, a patient coming in on a potential chest pain. The physicians are kind of not sure whether there actually was been a heart attack. They normally would potentially either discharge them and hope things go well, or admit them in for observation or upstairs. But here, potentially, they could slap a small wearable on and measure troponin levels and send them home and let them know if changes occur on essentially a real-time basis. So I see effectively this whole new field of continuous laboratory. And frankly, the physicians and health systems don't know what to do with that information right now because they've always only had episodic information. And there's a whole service infrastructure that has to be built behind it to deal with it. But we've learned a lot from continuous glucose monitoring, as I know you know at Novo, and we need to take those lessons and translate them into all the other areas of medicine that'll be impacted.
And perhaps there's even an opportunity to really use that to springboard into more of a preventive healthcare model, the well care model versus, the sick care model that we all have. If we can start to identify some of these biomarkers or things like that through these types of technologies, perhaps we can get ahead of them a little bit more than we have traditionally and help mitigate or prevent things from happening as well.
Well, one of the things healthcare has not had a good set of offerings in is feedback loops for patients that are timely. A lot of the feedback loops most patients experience are just every 3 or 6 months they might go in and see the doctor, and that becomes the feedback loop. But CGM gave us a 3-minute feedback loop, and that had huge impact. And I think as we see more feedback loops that the patients can respond to, and we have supporting systems for that, we're going to end up impacting that preventative area and preventing other downstream expenses and inconveniences because things are caught earlier. So I think there's huge potential there on both the cost side as well as the convenience side as we apply some of the same lessons we've learned from CGM. Yeah,
no, very exciting space. And hopefully we can continue to move in that very positive preventative direction. I think that would help everybody. So just there are a lot of questions I want to ask you. I know we're running out of time, but switching gears too, as we think about, again, in this technology space in healthcare, we really saw a move to leverage all of these things that have just sort of almost been kind of tangential during the pandemic. We had no choice. We had to really move to telehealth. We had to leverage these virtual connections or these remote patient monitoring types of technologies when people couldn't actually be live and in person. And obviously, we saw a lot of expansion and growth through things like the virtual care model in primary care, as well as mental health, which is still, there's a big investment still in that space. But from your perspective and what you're seeing, what's happening in other specialty areas? Because there have been some pullbacks as well. So what is your thought on where you're seeing a lot of potential investment and growth in other specialty areas?
Well, one of the things we specialize at TDV is in specialty virtual care. So actually all of our work is in specialty care. But we're very excited about what we're doing in the specialty care arena. So we have one of the most successful virtual GI practices in the country. It's now, as of September, will be in 50 states, called Ishi Health. It has an extraordinary growth rate, and it has the highest net promoter scores of any GI practice we know of in the country. Ishi Health is a heart failure practice that's virtual and very interesting. It bolts onto local general cardiology practices, and now allows that patient to not have to go to an academic center, not have to travel, in some cases, hundreds of miles away from home, and they can stay with their local cardiologist and still have access to heart failure specialty care. That one's really interesting, exciting. It also has really interesting RPM capabilities because beyond the drugstore instruments of blood pressure cuffs and weight scales and that sort of thing, they're really taking and building really interesting AI-driven algorithms off of implant data from pacemakers, defibrillators, pulmonary hypertension monitors, and loop recorders, for example. So there's a whole huge mountain of data that's really never been really reality applied for chronic care management in a practical way that Ishi's taking on. Remission is one that's working in rheumatology. And remission has an incredible rate of getting people off of biologics, which is a huge savings and a huge bit of convenience. And we're really excited about it because it combines lifestyle medicine together with rheumatology along with mental health and dietetics to deliver a kind of a complete solution as opposed to a fragmented solution. And then Tele 911, as an example, is a emergency medicine practice that's virtual. You don't see emergency medicine in the virtual world, but in Tele 911, they pair up with EMS services around the country and actually provide a emergency physician consult at the time the paramedics are actually with the patient. And in a very high percentage, the patient no longer needs to be transported to the hospital. And so they avoid the hospital, they avoid the ambulance costs, which in some communities in California, it's as high as $3,800, and they avoid the ER costs. So it's a huge opportunity of convenience, saves patients a ton of money out of pocket in terms of copays and deductibles, and saves payers an awful lot of money. And they're seeing the same kind of doctor they would see if they got to the ER and waited for 4 hours. So really interesting set of dynamics going on.
Well, it's a very thoughtful way to approach, leveraging the convenience factor with, monitoring resources, managing resources and things like that. I think it makes a lot of sense. And I love the, the holistic offerings instead of just offering a technology that's sort of monitoring one condition. A person is not a condition. They are a human being with lots of different things going on, and many, health conditions require lifestyle modification, mental health support. So those holistic offerings, I think, are really genius. And I hope to see more of that, as we move forward. But I think we're just about out of time, but I want to say thank you so much. As we talked at the top of the hour, or the top of the conversation, you've held so many positions in so many organizations. You're Chief Digital Officer with Eric Topol at the Scripps Research Translational Institute. You're the co-founder and operating partner of Cicada Digital Health, among other things. Do you have a favorite role? One that I didn't even mention? I'm just curious.
Yeah, you can tell I'm easily bored, so I have to do lots of things. I particularly like working with entrepreneurs, doesn't really manage the age, that want to change the convenience factor, the access, and the empathy level of healthcare service delivery. And frankly, those are such low bars by most of the competitors that it's fun taking on the industry when you compete on those features and then simultaneously work on the actual healthcare and clinical outcomes that you can achieve. But when you can attract patient volume because you can change dramatically the convenience, access, and empathy elements, and I don't just mean from the physician, I mean across the entire patient experience. As many people know, they love their physician, but they hate the office experience, or they hate the health system experience, and so many things that go with it. So I'm very interested, and that's really where I get my my energy from, is when we can make those kinds of changes.
Yeah, and I think if we can crack that nut, you just create such a more empowered stakeholder anywhere in the entire equation. And I think that's really, we want people to feel empowered to make the right decisions for themselves and with their treatment team and the like. So, but thank you so much. Just a wealth of information and experience, and certainly would want to have you back very soon to share some more of your insights, and congrats on all the work that you're doing.
Thanks, Amy. And you're in an exciting place now, probably the fastest growing pharma company in the world. So it got to be an interesting ride at the moment.
A lot going on. Yep.
Thank you.
Have a good one.